health and a little wealth and a lot of love.
One thing you said about the thyroid. Now, one thing I've know in my circle in conversation, if you are having issues losing weight, the number one question that people ask is get your thyroid checked. Mm-hmm. Why? Is that true, and why?
Well, yeah, and we just kind of talked about, how important the thyroid hormone is in all aspects of functioning, but metabolic function is huge. So your like basal metabolic rate, your metabolism, it's definitely a huge hormone in weight management, among other things, but especially in women, I would say we tend to see it in older women, but I think just with our environment and the lifestyles and the direction that we're going in, we're seeing it a lot in younger women too. And especially if you have a genetic predisposition, if you have a long line of family members who've had thyroid disease, then you're at higher risk. And it's a pretty easy test to order. A lot of doctors will order it on just annual physical labs if you have a family history. Some will just do it as a part of screening labs, which is not necessarily recommended, but if you have those symptoms, so if you have the unexplained weight gain, if you have the chronic fatigue, if you have the dry skin, the hair loss, the constipation, it's something that a lot of doctors will check.
Got it. So we laid the foundation of hormones. I'm not going to even pretend that I'm going to retain all that information, but it was really, really good. There are actually some nuggets in there that I did not know. So this is fascinating for me. And by the way, I probably ask you more questions in this episode. I go back to the beginning. This is seriously one of the most interesting topics that I'm very interested in. And I know all of you guys are probably interested in as well. So one thing a lot of people do is get their hormones checked. And I just talked about my primary care doctor rolled his eyes when I asked the question. What is that process, and what would you say if there is an imbalance? Like how does that all work?
Yeah, so a lot of doctors will specifically check hormones if there are symptoms present. And
so they only check it if symptoms are present?
Yes.
Okay.
And I'll kind of go into the why and the why not, a little bit of that, because honestly, I've been in that position before where I've had plenty of patients who say, I just want to get my hormones checked. And
did you really rise at them?
Internally, maybe not.
Oh, that's honest, y'all.
It's honest at the time because you're trained medicine in a certain way. You have so much time to see patients, and especially for some of these patients that are healthy, that don't have a lot of health problems, or you're trying to just do a preventative visit to check those boxes off about, the cancer screening tests, the things that have been clinically studied and, statistically significant cancer screening tests that we really want to focus on during the preventative medicine visits. And so, and also it's a simplification. I want to get my hormones checked. And we just talked about how complex the hormones can be and how many of them there are.
I did not know there was that many hormones.
That it's, we kind of have to get into, you got to ask more questions like, why do you want to get your hormones checked? What specific symptoms are you having? Which specific hormones do we need to be considering? And
for me, I think the number one question is, I'm tired.
Yeah.
I don't have energy. That probably is the number one question that's probably asked. And then I know our opinion on that because we talked about this. But yeah.
Yeah, and that's, we also, the way that we're trained, the way that we learn outpatient medicine and internal medicine and primary care is that you're trying to be cost efficient. And you don't want to be ordering all of these tests just for the sake of ordering tests. Because what are you going to do with those tests? And is it going to change management? So if you order all of these tests and you see that the testosterone level is normal, but on the lower edge of normal, and your TSH or your thyroid function tests are normal, which a lot of times they are, how are you going to change your direction? How are you going to tell the patient what they need to be doing? Because a lot of times if those levels are abnormal, or if they aren't in balance, if you have higher levels of one that are causing imbalances, it's a lot about lifestyle change. And if I'm going to tell you about lifestyle change to begin with, why do I need to get you to pay for all of these expensive tests?
I understand.
To get the same outcome by doing the
about.
same things.
Yeah, that's what we talked about.
With a little health and a little wealth and a lot of love. That's the life that we live. Suits and scrubs.